No surgeon wakes up intending to operate on the wrong side. We should also know that. But wrong side surgery has happened. And when it does, it's devastating. Today, we'll talk about how it still happens and how to prevent it. Welcome back to Nurse Mamli O, caring for you one health tip at a time. This episode 3 of my theater safety series, where we discuss what really happens inside the operating room, to systems that protect patients when the pressure is high. Today's topic is uncomfortable but necessary. Wrong side surgery. Wrong side surgery means operating on either the wrong side of the body, the wrong organ, the wrong patient, or even performing the wrong procedure. It is classified as a never event, meaning it should never happen. But medicine involves human beings, and humans can make errors. So how does it still happen? This is where we need to be honest. It usually isn't one big mistake. It's a chain of small failures. It happens like similar patient names, for example. Two patients on the same operating list with similar names and rushed verification. Therefore, it is missed. They may be coming for different procedures, but similar names and nobody really checked. And then there is documentation errors. This is when incorrect side is documented. Incomplete consent form, electronic record mismatch. The third is poor communication. Assumptions are made. Nobody double checks, or a junior staff afraid to ask. And the fourth is rushed theater lists. Pressure to start early, pressure to finish on time, or even corners mentally cut so that the procedure is started on time. The last is the site not marked properly. Surgical marks can fade after skin prep. Marks may be hidden by drapes, or wrong location is marked. Wrong site surgery is not about incompetence. It's about systems failing. So how do we prevent it? There are a few steps to prevent this. The site for surgery should be marked while patient is awake and confirmed with the patient. Here, the surgeon has to confirm verbally with the patient about the site and the procedure they are going to perform. The patient is actually the first safety check. When there is verbal confirmation during sign-in, name, date of birth, procedure, and site is read out loud and clear in front of the team. WHO timeout. This is World Health Organization timeout. Before the incision is made. Some people do it, as I said in my first episode. They do it before the surgeon's scrub and the patient is draped, and others do it after the patient is draped, the surgeons are ready to cut. That is when they do the timeout. This is to confirm the identity again, confirm the procedure again, confirm the site or side again, and confirm the marking is correct. Timeout exists because memory is not enough. Then there is the culture of speak up. This is powerful. In theater, safety means anyone can question anything. A student nurse, a healthcare assistant, or even a junior doctor should be able to ask questions. Hierarchy should never silence safety. Then there's the emotional impact. When wrong side surgery happens, the damage is not just physical. The patient loses trust, the family loses confidence, and the team carries the emotional weight. That is why we take these process seriously. Then in theater, I have seen careful teams confirm and reconfirm everything again and again. And sometimes someone speaks up at the last minute and prevents a mistake. That pause matters. That voice matters. Wrong side surgery is rare, especially with the World Health Organization surgical safety checklist. But rare is not zero, which means they still can happen. And safety is not about assuming, it's about verifying. Systems protect patients when humans tend to rush or are distracted. In theater, safety is structured, discipline is under pressure. If you found this episode helpful, like, subscribe, and share to Nurse Mamli O. Next in this series, we'll discuss infection control in theater and why sterility is everything. Because in theater, safety is never accidental, it's intentional. See you in the next video, and remember to watch the full operating theater series. Thank you for watching. Hi, surprise, surprise, surprise. It's only me. I'm back again. I'm sure you're surprised. You thought the video was coming to an end, but no, I decided to come back and give you examples on this video that you've just watched about wrong side surgery. I've had some experiences as a theater nurse through the years of my work experience. I think I have more examples, but I'm just going to give you 3 because I don't want the video to be long. The first one is a long time ago when I was a young nurse in theaters. At that time, there was no WHO checklist. If you remember earlier in the video, I think actually not this video, the episode 1 video explains what WHO checklist means, how we check patients into theater. If you haven't watched it, go back to episode 1 on this series because this is the episode 3. We're on episode 3 now. So that episode 1 explains to you what WHO checklist means. WHO checklist actually is World Health Organization checklist. It's a pre-op checklist before surgery. And this is worldwide. It's used globally for all theaters. Anybody who is working in theaters uses it before surgery. This is to ensure safety for patients. So that time, there was no WHO checklist. But still, in theaters, we still used to check patients against the operating list to make sure they are the right patients coming for surgery. But now the WHO checklist, there's a lot of things in it. The things that we used to omit maybe was omitted many times, and the made patients have maybe wrong side surgery or wrong operations. Anyway, I'm here to give you 3 examples that I have encountered during my work experience as a theater nurse. That long time ago, there was a patient who came to theater. I wasn't part of the team, but it was a patient who was brought to theater when I was not there. This patient was a neurosurgical patient, a patient for brain surgery. The patients normally for brain surgery, either they've had injury to the head, they fell, someone hit them on the head or something like that. So then they have a hematoma. Hematoma is the blood that clots just on the head after an injury. So when somebody is brought to theater, normally you find that they're either confused because of this clot or they're in semi-comatose. But this patient had been on the ward, and on that hospital, there was a neurosurgical ward where patients for neurosurgery only were admitted from road traffic accidents, head injury from being hit by something or a blunt object or something like that. So you found some of them were in coma, semi-comatose. Some of them were just confused walking around the ward. They didn't know what was going on. So this particular patient was one of the patients who were confused. They tend to even forget who they are. So the nurse on the ward prepared a patient who was on the list. And remember, when patients are coming to theater, the preparation starts from the ward. That is where someone identifies them because they're the ones who have been looking after these patients. They put a wristband on their wrist for identity. I'm not sure what other places do, but I know some people put on the gown, but they put a wristband on this patient and brought them to theater for subdural hematoma evacuation. This patient was not the one to come to theater, but the nurse brought the wrong patient with the name of another patient for the right surgery. The wrong patient with the wrong names for the right surgery, if you get what I mean. So the patient, once the patient comes, remember there was no WHO checklist then. When the patient comes to the theater, there is a place where the patients are received before they go into the operating room. This is called the waiting bay, the receiving area. So this receiving area, the nurse there will receive the patient. She's looking after patients going to different theaters. This was a department with so many theaters, 12 theaters. So each theater was receiving their patients, but they wait at the waiting area. So each theater comes for their patient. The patient was brought. Of course, the patient does not identify themselves. They are confused. The nurse hands over to hands the right operating notes, the file for the patient, which corresponds with the wristband, but the patient is the wrong patient. But the receiving area nurse will not know this is the wrong patient because the patient is not going to confirm. So the patient is taken into theater. The patient was operated on. Surgery that was not planned because the patient was on conservative management, did not need surgery. But the patient who was supposed to be operated on as an emergency was still lying on the ward. So this is what happens with the wrong, if you don't check patients properly. Wrong patient, wrong surgery. So the patient had to be scheduled for theater again, the one who was on the ward. And then the protocols of discipline was followed. Then another incident is where this one, now I was working in a place where there were 6 theaters. And actually it was one of my theater was one of the theaters. Patients had 2 similar names. One was actually coming for plastic surgery, something to do with the hand. And another patient with a similar name was going to the opposite theater for ear surgery, ENT. But the first patient who was taken into theater from also the receiving area, the plastic patient was taken to the ENT theater. So even though that was also a time when there was no WHO checklist, even though we didn't have the WHO checklist, but we still checked patients against their notes to make sure they are the right patients and they consent. So because this patient was alert, they managed to say that is actually not them and they were not coming for that procedure. Unfortunately, even the anesthetist saw that this patient had something wrapped around, the bandage was wrapped on the palm because they had injury. They were coming for repair of tendons and some other structures. Someone had just was going to slash him and he put his hand and it was cut. So that also showed them that this is the wrong patient because they were waiting for a patient to have ear surgery. So this is now a case where wrong surgery has been prevented. Theaters still did not have WHO checklist, but we still used to use our own methods of checking patients in and making sure they're right before they are put to sleep. But fortunately, the patient is awake. They also had something wrapped around their hands, so it was easy to tell. Then there is a patient also who had knee arthroscopy. The patient had the wrong knee arthroscopy. Right procedure, right patient, right patient, right procedure, wrong site surgery, which means the patient was actually coming for the right knee, but the left knee is what was operated on. Someone at that time also, there was no WHO checklist. So the patient was brought. That is just a story a friend of mine who works in theater told me actually. Patient got into theater, but on the board, the nurse wrote the wrong site. the wrong side. That is how the surgeons prepared the wrong side, they cleaned and operated on. This patient went back to the ward and was shocked when he woke up, because now the limb that was painful before was still painful, but the one that wasn't was more painful than the other limb. So they had to explain to the patient, they were disappointed, the relatives were disappointed, and they had to reschedule urgent surgery for the side that was actually supposed to be done. I think this explains what wrong side surgery does. It's really traumatizing to the patients when we get it wrong in the theaters. But I think with the WHO checklist, now everybody is keen, because there's 3 steps that if you miss one, someone will question something. Everybody goes through the list before, in the morning before we call patients in. Patients are discussed. Everybody in the team discusses the patient, and that is called a debrief in the morning. We discuss all patients and the procedures that they're having, what is required for all patients. And I think this has really saved so many things that would have gone wrong. As a theater nurse, I am happy this WHO checklist was invented. And thank you so much. If I find more examples, because there are very many, I will actually come back and share with you. For you scrub nurses or doctors, surgeons working in theaters, or even healthcare assistant, a student, have you ever experienced anything like this? Wrong side surgery or wrong side surgery or wrong patient? If you have, please comment on the comment section below, and let's share and tell us how this was a learning, what lesson you learned on this. And thank you so much for watching. See you in the next video. Bye bye.